It starts at birth and ends at death. Our health. And for most of our lives, we play a numbers game. How much do I weigh? What's my blood pressure? And others. But the greatest numerical threat to our health might actually be our zip code.
The magnitude of the problem is huge. There's no question about it. It's a complex problem. There are many interrelated factors, and the solutions are going to be just as complicated. Hard is not a reason not to do something, especially things that are valuable. Nothing that's valuable in this country comes easy.
A child's life expectancy is determined more by his zip code than his genetic code. And I think that we can do something about that.
If you look at the health of a population, it's only determined about 10% by what we do in hospitals and clinics and doctors' offices. 90% of the health of a population is determined by other factors, including things called the social determinants of health. And that means that your educational status, your job opportunities, the safety of the neighborhood that you live in, those kind of social factors are actually much more powerful drivers of the health of a population.
You know, what I don't see a lot of in the United States, I live in a low-income neighborhood myself, and what I don't see a lot of is, people starving, I mean literally starving. But what I do see a great deal of is people whose diets are really negatively affecting everything about their lives. Their ability to have healthy, successful lives, their ability to do well in school or hold jobs. And that part of that is personal responsibility. We openly admit that and acknowledge it, that part of it is making the right choices around your diet once you eat. But a big part of it too is having access to folks so that they can make those good choices when they get their education to be able to do that.
The United States is littered with food deserts, areas with little or no access to traditional grocery stores that offer fresh and affordable foods that are essential to maintaining a healthy diet. Instead of such stores, neighborhoods in food deserts depend on fast food restaurants and convenience stores that rarely provide nutritional choices.
I've been in the third world, and this is not the third world, but we're all paying a price for the fact that healthy, affordable food is not available in certain communities. And those neighborhoods in particular are paying a very high price because what we're saying as a society is that it is okay that some folks don't have access to these things. And in my book, if folks make bad choices after we give them the choices, then that's on them. But if we as a society cannot at least work hard to give folks the right choices, then that's kind of on us.
1 million people in South Carolina live in a food desert. That's 20% of the population.
Not having a grocery store in the neighborhood, we have to go a long way out to a grocery store. There's just none around here in the North Charleston. So we have to go further way out to get to a grocery store, to a large franchise grocery store, because there's only convenience stores in the neighborhood.
When you don't have a grocery store nearby, particularly if you don't have access to good transportation, and we have decent bus lines here, but you're talking about an hour trip to the grocery store, an hour trip home from the grocery store, trying to figure out how you're going to get the groceries out of the grocery store and into your front door on a bus ride. So going to the grocery store stops being something you can do pretty easily and starts being a half-a-day commitment. And so that changes folks' ability to work in jobs, it changes folks' ability to take care of kids, it changes everything.
The health impact on the community from a grocery store or any healthy food retail outlet is generally positive. So although we can't say that a grocery store in and of itself contributes or causes a lowered obesity rate, we know that it is one of the contributing factors. So without the access to healthy, fresh food, a person's choice is inhibited. They're unable to, even if they made the choice, unable to execute on the choice, if they will.